Hi everybody, this is Caroline Sotheby and welcome to Up, Down, and Around Town. Okay, like most of us, we heard the directions from our governor and the health staff a couple days ago. So everything that you heard in the last couple weeks, forget. You just have to know that from now on, for the next 3 weeks especially, Dr. Claus said that all the students from kindergarten all the way up to the senior class is on, quote, remote. So what you heard they were doing, it's null and void as of now, okay? Another thing, we had our Mayor Pro Tem and we had Heather talk about the tree lighting ceremonies and the parade. That is next also for the public. So slow but sure, we might be giving you more information in the next couple of weeks. We will be closed here at the studio for 3 weeks, and Rich and I will be on the road again. How about that? So if you see us, say hi. Okay, anyway, we have to get down to the nitty-gritty because a lot of things are happening. People want answers to many questions, and with me today, I have somebody from Henry Ford Hospital, and hey, welcome. I know you got a last minute, hey, can you come on? And thank you for coming. First of all, you said you came into our area in June.
I did.
And thank you. How do you like this area, though?
I absolutely love it.
You
We've
do?
thoroughly enjoyed being new transplants here to Michigan. We had a beautiful fall, so it was
Yeah.
lovely weather, nice people.
Okay. What is your title and what are your qualifications basically for that department?
Sure, thank you. So my name is Brooke Buckley, and I'm a general surgeon and currently serve as the Chief Medical Officer at Henry Ford Wyandotte Hospital.
Okay.
So I've been in practice for about 13 years and transitioned into an administrative role, which is what Chief Medical Officer is, where basically my role is to work on behalf of the medical staff and the patients as it relates to having a positive patient experience and a strong, safe medical staff for the hospital.
So you do go through the floors then and talk to maybe even patients? Is that the possibility?
So my role is a lot of meetings, as these end up being.
Yeah.
But a really important part of being an administrator in a hospital is walking through the departments, is knowing the staff and the employees and getting feedback from patients to make sure that we're doing the best that we can on behalf of the community.
All right. And of course, March was deciding a big step. I don't know if it was forward, but for especially the medical department, a lot of things transpired from then. Sort of took a lull, but now when you start looking at some of the feedback that we're getting from the health department, I think we're having increasing COVID patients back there again, right? And is it really going at Henry Ford Hospital, or is it just more or less around the downriver area?
So you're absolutely right. Your observations are correct. The numbers are rising again for COVID-19. They seem to be rising similarly in the various local hospital systems.
Okay.
Certainly Henry Ford is seeing an increased number of patients now versus over the summer. Fortunately, the numbers have been somewhat stable over the last several days, but we did see a pretty significant uptick with people going back to school and maybe around some gatherings that related to Halloween holidays and various sporting events. We really seem to understand that when those numbers go up, that it often is related to large groups of people congregating, as we love to do as people, and we miss so desperately in 2020. But those gatherings, especially when we are letting our guard down for the social distancing, which of course is that 6 feet apart at a minimum, and wearing our masks over both our mouth and our nose, those create opportunities where we can transmit the virus through our particles in our respiratory saliva and tears and things. And so that is an opportunity where we seem to see that the virus numbers are rising a little bit again here in the fall.
Okay. For some people that say, oh, it's hogwash, there's no there's no information out there that says it helps. But at the same time, we believe it does. I have some family members that don't agree. They figured if you're keeping your distancing, you know who you're going in contact with. And that person individually, I said, well, you're not in a town where your homes are all the way around. You're in an area that have acres, and you can walk your area and not meet anybody. So you can say one way, but we have to think another way. So can you give some advice to them, basically?
Absolutely. I appreciate that the understanding of this virus and our current pandemic situation is changing rapidly. And so sometimes that's really hard to know what to believe and how to take all that information. It's a lot to process in the medical profession, so it's certainly a lot to process if you're not in the medical profession. But the things that I do believe in strongly and that I do know is that the spread of the virus is coming through saliva. It's coming from contact between people in those secretions. And so anything that we can do to limit that spread is not only helpful for ourselves, but it is part of being part of a loving community. And so for us to take care of our friends, our neighbors, the elderly or the ill in our community, it's our responsibility to wear masks, to do the social distancing, to try to protect the people that we live near and around. And so even if I myself don't feel that I have a significant risk, everybody's entitled to their own opinion. But I think that a plea towards people is being part of a community. We're humans, we live in connection. And it's the least that we can do to help support and protect the people that we love that live near us.
You said there's an increase. You more or less think it because maybe schools start, there's more sports, there's more kids' activities, and the spread sort of got around that way. Is there any other possibility other than that? Or is it just at this time of year when they figure somebody's going to get hit sooner or later and you're the one, and so on and so forth?
You know, it's hard to know. So we've done a lot of what we call contact tracing, where we take a person who has tested positive and then we look at the places they've been. And oftentimes those contacts lead to things like large gatherings, Halloween parties, sports parties, those kinds of things, funerals, unfortunately. And so we know that people who have congregated in those areas tend to come up with higher numbers of the virus than people who have observed the masking and the social distancing. This is a really hard time, obviously, where we're being asked to live our lives in ways that we've never lived our lives. And so it's natural that we would let our guard down, especially when we're in a gathering with people that we know and love. And so any of the things that bring us together in community, and in Michigan, certainly sports, the school trying to do what we can to help support the isolation of children, the education of children, bringing them together. And of course, as holiday seasons and just life events like weddings and graduations and things bring us together, it raises the opportunity for the virus to pass. I think specifically, you know, here in the north, as we come into winter and it's harder to be outside, this is a time to be specifically vigilant that we aren't letting our guard down because those close contacts will, in fact, lead to more spread.
Is there any reference out there as to how long this might take for us to say goodbye to it?
So there,
or is that just a prediction like everything else, right?
At this moment, it's a prediction. I think there's some really hopeful news on some positive vaccination results. The Moderna vaccine was actually, we were part of the trial at Henry Ford, so we enrolled tens of thousands of patients we were part of that large enrollment to vet that vaccine, and so that's very exciting. There's been a lot of push to get those vaccines out early, which is wonderful. And to cover the population, we need a lot of vaccines, and so it will take time not only to get the production to where it needs to be, but also to get enough people vaccinated that it is effective for the population. So there is hope. There's absolutely good scientific hope that we've got an opportunity to manage the virus, but it is going to take a while. I heard that Dr. Fauci had predicted maybe third quarter of 2021, so looking maybe towards next fall as really the earliest times that we could be thinking that that there's a lot of coverage, and that's at this point scientifically backed, but still a lot of variables that we have no control over. And so, it's a journey.
Of course, I think the medical field has learned a lot from March till now.
Absolutely.
And that's probably the reason less deaths. What have you found out in the Wyandotte Henry Ford Hospital? What's the new practices or the new medicine or treatments?
Absolutely. No, so there's a lot in the news, of course, about all of the changes in treatments. And I think really that the most helpful things to share are that for better or for worse, the whole greater Detroit area had a very large experience with COVID. We had many, many sick patients, as everyone is aware. But what that means in terms of the healthcare facilities and doctors and nurses is that the people that are on the front lines have taken care of many, many people with COVID. And so the more you practice, the better you get, whether you're a pianist, a baseball player, or a practicing healthcare provider. And so having cared for so many patients with COVID, we know a lot. We've learned a lot. The science across the globe has really increased fantastically. And so we understand more about how to take care of people's lungs. We understand more about how to take care of people in terms of the medications that are helpful or not. And we understand more about how to keep families connected during this scary time when their loved ones are in the hospital.
And that, I think a lot of people that I know have had that experience with somebody in the hospital and you love to be there and they vice versa. And their presence would just be, so to speak, in the way. But the person on the other side doesn't believe that. Like, he's got to, or she's got to see me there. But in a sense, that limits the people, and you can concentrate basically on your patients. And how many patients do you roughly have now with COVID?
So at Henry Ford Wyandotte Hospital, we've had more than 40 patients, but not more than 50 for the last week.
For the last week.
So we've stayed at a fairly level state. But when I came to Michigan in June, we had 0 or 1 for a very long time. And so it's certainly a significant increase in our hospital and in our system. But those cases seem to not be rising quite as quickly as they did in the first wave so far.
Why does a person actually come in? What's their symptoms at that point?
It's a really important question. Many of the people that we see in the emergency departments are there because of breathing patterns, because of just not feeling well, overall fevers, respiratory issues, so coughing, runny nose, those kinds of things. But it's really important to know that COVID presents in many people in unexpected ways. And so oftentimes people will show up with a headache or pain in their belly, and something just doesn't look right. And again, that broad experience that we've had, our doctors are very good at noticing that something isn't quite right about the way that their belly pain looks. And so there are times when COVID presents in a way that it's kind of unexpected, but many of the people that are actually need to come into the hospital, it's mainly because of their breathing.
Okay. So if they do come, how many days do they normally stay before they're released?
So that's a broad experience as well. But on average, people are in the hospital between 5 to 8 days.
Really? So by that time, they've gotten medication, treatment, felt better in breathing, and say, okay, let's try it at home. At least you're not getting those vents on there, right?
Well, there are still some people who are getting very, very ill from COVID, and so I certainly wouldn't want to give the impression that the very ill level of COVID is in any way gone. It's very much still a part of the experience. But fortunately, we do have opportunities in treating people, and there does seem to be a little bit less of that really severe presentation right
Okay.
now.
So the idea is, if you don't feel well, get down there, because for a while I think it was like you don't want to go there, and if you're tested negative, they're going to send you home anyway. So that sort of relaxed its form, but now you said with the increase in patients there, you might be putting out that emergency tent again, right?
So there's a couple of things I'd love to share. I mean, you share so many important points. So one is that our bodies continue to have all of the normal diseases, so heart attacks, diverticulitis, appendicitis,
Yeah.
pneumonia, all of those things still go on. They don't know about COVID.
Right.
And so we did see a lot of people that were afraid to come to the hospital in the first wave, and we have subsequently, later on seen people with much worse presentations of heart attacks and other things. And so absolutely one of the things we've learned is how to keep people that don't have COVID safe in the hospital. And so if you don't feel well, if you would normally have come to the hospital or to your doctor, you absolutely need to still come to the doctor so that we can take care of people that potentially don't have COVID. As far as the people that do, and as the numbers potentially are rising, you will see a tent out in front of Henry Ford Wyandotte here locally, and that isn't because things are out of control or things are scary. That's because we're preparing, being ready for the models that are out there that suggest that the numbers will rise over the winter. With it being so cold here in the winter, we need to make sure that we have a space that's outdoors that we can heat and appropriately outfit. And we know that we don't want to do that in an emergency. We'd like to do that in a controlled fashion. And so this is preparing for the worst
Okay.
and being ready for the best.
So right now there is no tent, but then it might come up. But then, like you said, you're preparing, and it's a phase one. This way, at least you got your area situated with the people that are sick versus some that are coming in for another reason. So,
Absolutely. We are very much dedicated to keeping people safe and to being prepared. We follow the incident command structure. That's a national structure to increase our communication across the system so that we know what's going on in the different hospitals so that we can keep people
Okay.
safe and respond to the science and the information that's coming, as you already said, so quickly and so fast and furious.
okay, any other information that somebody out there might be wanting to have answers to? What questions are you usually asked by?
No, it's a great question. There's just so many questions, and I think the best advice is to really pay attention to what's going on, but really consider your friends and neighbors as we move through all of these different recommendations. There is no perfect science here at this moment. We are very new in understanding this virus, but we know each other, we know our communities, and we know how to care for each other. And so going back to those basics of how we take care of each other as families and faith communities and local neighbors and friends, these are the opportunities where we can really beat this virus together by not giving it an opportunity to spread unnecessarily.
Okay. And of course, for everybody to make sure you get your rest, keep your body in fairly good condition. That's about the only thing, really.
Absolutely. And one really important thing that you just reminded me of is to get your flu shots as well, because the
Okay.
regular flu season is coming. And we're actually technically in the window. And so getting those flu shots will help protect from your body getting worn down from other diseases, which will also help protect you from COVID. So,
All right. And, it's sort of like we're on the outside looking in. You have a chance to see what's happening, and the changes now. So you have no idea what the next couple of weeks or months are going to really happen. People are not going to be outside like they were because of cold weather. So you're going to be more or less, if tempted, to go to that little party, even though it's only a birthday party. but there have been cases where there were weddings and people have turned out to get the COVID just from maybe one or two people, and it spread after that. So, like you said, you're aware of the people around you, your family, your friends, your neighbors, and sometimes even though you like to say, gee, I'd love to, you sort of have to hold back a little bit.
Absolutely, and I think, trying to look at the glass half full, the way that we've traditionally made memories around the fall and the winter and all of these activities, this is really an opportunity to make new and different memories. It doesn't feel like it's what we want to do, but it really is an opportunity to figure out how to connect in new ways and in different ways. And it absolutely will be something that will impress this younger generation, for the rest of their lives in terms of what they experienced. But there are so many inspiring stories about ways that people have figured out other opportunities to connect. And while that wasn't our first choice, you can really make a great second choice out of creating those new opportunities.
Hey, thank you. I appreciate you coming. I have to say hi to our friend over there, Audrey. She's the one I kept on calling and saying, hey. and we had talked to Dr. Ganaga, who had been on in March, and he just couldn't make it today. So they asked you, and you willingly came on. I appreciate that. If we ever have any more questions, or you find out something that, hey, I just found out something that's important, let us know. Come on, okay?
Wonderful. Thank you so much, Caroline.
You're welcome. And I hope that helped you get some answers to some of your questions. As usual, we all don't have the answers because this is a continuing saga, so to speak. And as we live through it and go through it, we're going to have many experiences to tell our kids and grandkids in the future. So with that, I thank everybody that had a chance to come to the studio today. Like we said beforehand, we will be closing down for 3 weeks with the governor's request, so to speak. Rich and I and maybe some of the crew will be going out on the road as we did before. Whether we're going to come every week or not, but we're going to try to keep you informed. And so with that, we'll have to say happy Thanksgiving, happy holidays, and take care of yourself. Keep washing those hands and keep the mask and keep your 6-foot distancing. Take care, okay? Take care. Bye-bye.